So I'm really excited to share a little bit about cells in orthopedic repair, how that relates to cells and their environments. I want to thank the organizers and Science for Georgia for really inviting me, allowing us to share what we do. So kind of fitting the theme of this presentation, I want to talk a little bit about my background and being a product of my environment. So just a little bit about my background and talking a little bit about nature versus nurture. All right, so the obvious part about nature versus nurture is our parents, right? So nature versus nurture, right? So my parents get a lot from them. I look a lot like my mom, and I act a lot like my dad. Now, I think part of that acting is that I can actually look like him with my mustache, but in general, we get a lot from them. And I want to talk a little bit about genetics versus environment. And I'm not going to get too much into genetics, but more that that's sort of the nature part, right? What's built into people and what's built into our cells versus the environment, right? So what's around us and how that molds us. So some of the things that I learned a lot from my parents and some things that they did, there's a lot of emphasis on math. And my father, when I was in kindergarten, first grade, would make me do these times tables. So that, in my environment and learning that, I now have decent math skills. There was always a pursuit of perfection and how I can improve. So that was something that was instilled in me kind of from day one. So there's a little graphic from Remember the Titans there where the character played by Denzel is talking about perfection. And one kind of little cartoon at the bottom here is saying that the Indian cobra can kill 97% of its prey with one bite. And my father would always say, well, where's the other 3%, right? And that's when I'd come home really excited with the quiz that I got a 95 on. And my dad would say, where's the other 5? And it's not necessarily being too hard on me. It's more that, hey, where are ways that we can improve? And I really try to instill that. I've taken those lessons into my job now. So some other environmental factors one is my older brother. I'm not trying to tell you my life story here, but just more how my environment influenced myself and how that then relates to cells. So I started playing sports when we were early. We're both New York Giants fans. And I have a strong interest in medicine because of my brother. So he is actually a pain management physician up in Wisconsin, and a pretty good Google reviews there. So I think that has really molded what I like to do, that I want to help people with some of their orthopedic problems, right? And their pain that they get with that. And I think that environment, as I was growing up, and that role model to look up to molded me. Another person is my wife. So my wife and I met about 8 years ago. We started dating early in my PhD. She taught me a lot she taught me to be silly. She taught me to do, just really, take things into perspective and appreciate things. And I think that, combined with what my parents taught me about perfection, have really helped me to achieve a nice balance between the two. And one thing is that she is actually a kindergarten teacher. So she has taught me a lot about communication skills. Communicating to kindergartners is very tough. I'm not comparing any of you to kindergartners, of course, but I think that those really help me in terms of how I've developed. So again, a quick snapshot. Lewis kind of went over a bunch of this, but I grew up in northern New Jersey in a town called Rockaway. From the beginning, I was really interested in math, science, and engineering, so I went to a magnet high school. And actually, we developed this hands-free trash can. So if you ever go to a fast food restaurant and you never want to touch the door of it, right, to open it up, we actually swabbed it and found like 35 different types of bacteria on there. So I've always had this interest in health. And then we actually then decided to build a hands-free trash can that you could go in and use. So this is 15-year-old Jay. A lot has changed since then. I then went to Rice for my undergrad. I was interested in bioengineering. I'm not going to explain any of this, but these were just 3 different things that I did while I was there, learning about cells and forces and concussion and health and medicine. So I really enjoyed each of these opportunities that I pursued, but then they guided me towards a field that I'm really interested in called tissue engineering. I'll go more into that How about that a little bit later? Then I went to Rutgers, like Lewis mentioned. I was split between a biomedical engineering department and an orthopedic surgery department, and that again is my background. And then went to Penn and did my postdoc there, split between Penn and the VA. And I just want to thank these 5 tremendous people. They were my 5 mentors throughout my training. And again, fitting the theme of product of our environment, having mentors like that have been just so influential in terms of guiding me to where I am now. So, talking a little about the Patel Lab that's split between Emory and the Atlanta VA. So on the top there, we have our new Musculoskeletal Institute. I'm not sure if anyone's been there yet or seen it. It's right off 85 by North Druid Hills Road. So it's 5 floors of clinical space. The top floor is all research. So we interact with clinicians and orthopedic surgeons every day, trying to develop new therapies for people in the clinic. And in the bottom there, we have the Atlanta VA. So we're very committed towards providing solutions for our veterans. And these are really important, right? This environment has allowed the last 2 years of me starting a lab here to really go well and really try to develop these new therapies. Also part of the environment are the people in our group. So I like to acknowledge them sort of from the start. So these are the people that are driving the work that we're doing in the lab. We have a range from people in their undergrad all the way to their postdoc. So it's just tremendous people. I've learned a lot from them. So again, surrounding yourself with these great people really just makes the overall work environment great. So really quickly, I'll give you an overview of today's talk. I'll talk a little bit about the cell and its environment. So I'll switch over to this screen up here. So in this blue here, you have a cell. And then in the orange here, you have the environment around it. And the cell is constantly signaling with this environment around it. So I'll give you a little bit of background on that. I'll also talk about how environments impact cells in health, disease, and repair. So if we go from a healthy cell to now a damaged cell or a damaged environment, you can see that a lot of things are changing here. And then finally, I'll tell you a little bit about what we're doing in the lab in terms of trying to tune these cells and both their environments as well as the perception of cells of their environment. So first things first, what is a cell? I think everyone here at some point has heard of what a cell is. So this is a really complex view. I'm not going to go over every single thing in a cell, but we all, in the middle of it is something called the nucleus, and that's kind of the center part of the cell that has all of our DNA, and it's really responsible for how our cells respond. There are also many types of cells in our body. We actually have, I believe, almost 38 trillion cells in our body. So that you can imagine how small they are, and there's many different types. So just looking through here, we have stem cells, which you've probably heard of. Almost every different tissue is made of a different cell type, so bone, blood, muscle, endothelial cells. I'm going to talk a lot about cartilage today, so there's a separate type of cell that's in cartilage, and all of these cells are really influenced by, again, their environment, and they're also influenced by their nature, so what was given to them in terms of their genetics. So just a little snapshot of this. So in the bottom left here, we have a muscle cell, and you can see that cells then form tissues, tissues then form organs, and organs then form organ systems, right? So if you can go from a single cell to a piece of tissue to, let's say, a bladder to your entire urinary system, and all of these things work together. So really understanding how cells work and how they respond to their environments can help us understand how whole organs work. All right, so again, the theme of today's talk is product of their environment. So there's the cell, and it's the product of their environment. So what's around the environment is the matrix. And obviously, when you hear the matrix, you think of the movie, right? And honestly, Neo is embedded within a matrix, right? And I think that you can think about it that in some ways that he was actually able to influence the matrix around him. And I think that's something that we think of in terms of cells. So here's just a quick snapshot of what this looks like. So these little 2 gray blobs are cells, and around them in the green and blue is matrix. And what cells can do is they can latch on to their matrix, they can pull it to themselves, they can push it, and how they respond to their matrix is pretty influential. All right, so there's many types of matrix around a cell. One of them is called collagen. I'm sure most people here have heard of collagen. Sometimes you can grab some from the store and apply it to your skin. There's a few different types. There's actually, I think, 25 different types of collagen. And each of our different tissues is composed of different types of collagen. There's also all these other things. Again, not going to talk about the specifics of you've maybe heard of some of these things like hyaluronic acid, maybe elastin, but these are different types of proteins and fats and carbohydrates that are within our tissues, right? So as we eat our diets, that actually influences what's within our tissues. And the composition and organization of these tissues is very important to their function. So I'm just going to pull up this. This is an image of cells and matrix in fat. Okay, so if you look, these white kind of holes, those actually are fat cells, and they're able to store fat. All right, and then around them you have this very limited matrix around them, and this allows the tissue to be really soft, right? Which is why our fat is pretty soft. However, some other tissues, for example, like tendon, are very aligned. So our tendons connect things within our bodies, and they need to be very aligned, and they're very dense. They need to be strong, otherwise they'll tear. So that's really important. And then finally, here is an example of skin. All right, so skin has a very layered approach from the top to the bottom. So again, the composition, the types of matrix that are around our cells in these different tissues is important. All right, so one of the things, again, products of their environment is cells interacting with the matrix environment, right? And that environment is influential. There's a lot. I apologize for some of the graphics being a little complicated, so I'll try to point out what I can. But in the bottom here is the cell. This is the cell border here. And then this is the extracellular matrix, or the matrix around the cell. So this is really zooming in and taking a snapshot, right? So you can see a collagen fiber here. So I mentioned that. Fibronectin is another one that I had mentioned. And then inside your cell, you have a bunch of other things. But what's really important is that the cell can actually attach to the matrix around it. And based on the properties of the matrix, we'll create different attachments. Okay, and I'll cover more about this in a second. All right, again, lots on the slides, so just follow me, all right, if you can. This right here is a cell. And cells do a lot of different things. They can migrate through your tissues. They can actually move through the matrix. Okay, they can actually divide or proliferate, they call it. And one of the things that's really important is, again, how they interact with the environment around them. And because cells are microscopic, their microenvironment around them. And all of the things, how it's aligned, how dense it is, the types of matrix that are there are really important in terms of how they respond. So like I mentioned, cells are able to grab onto this matrix. So again, here's actually the matrix on the bottom here, and they use these adhesion sites to actually grab onto that matrix. And that is actually something that we study in the lab to try to understand how that influences cells. Okay, so now applying this to health and disease, right, and putting this into context. Why are these things important? So this is an example of a cell here, and the main thing that I'm trying to highlight is a feedback loop that happens. So what happens is that these cells will produce matrix, okay? And when they produce matrix, imagine having a denser environment around you. Now you have more sites for your cell to attach to. And if you have more sites for your cell to attach to, then they actually produce more matrix. And it's almost this endless loop that happens. Now, that's really good in some scenarios. Imagine if you have a cut on your skin, right? And it first bleeds a little bit, then it clots, and then over time, matrix forms, and you end up with the scar. That's good, right? Because it prevents, infection, prevents things in your body. But in other tissues, this is actually not so good. So one example of that is the liver. So in the liver, normally, you don't have a ton of matrix. It's actually a very soft tissue. So that's on the left here. But when you start to have any form of liver disease or any liver scarring, they start to make more matrix. And then this actually becomes a stiffer organ, and it inhibits the function of the liver. So that's actually, that's an example of where this matrix production is a bad thing. So again, I mentioned all of the different types of cells. Part of this is nature, right? So the different type of cell that it is. But then if you influence the environment and change the environment around these different types of cells, that's different for different diseases. So for example, here is a liver. So from left, you have a healthy liver. And as you go to the right, you can notice that it becomes fatty. You have fibrosis or fibrous tissue forming, and then cirrhosis or cancer. So those are kind of your end stage, and you want to try to avoid that, obviously. So again, this is just one example of how matrix production can be bad and how this cell, when it interacts with this more fibrous matrix, it can get worse and worse and worse. The same thing applies to the lungs. So obviously with the last couple of years with the COVID pandemic and other sort of lung diseases, normally your lungs are very open, don't have a ton of matrix. But if your cells get this preliminary thing that tells them, hey, make more of this, those cells don't like that. And then in response to that, they actually make more and more and more. So you get scarring of your lungs, and that's why it's harder to breathe then. So if you see on the left here, right, these are sort of open circles. And then as you start to fill in those circles, that makes your tougher and tougher to breathe. So obviously in the title, I mentioned product of their environment. So hopefully I've told you a little bit about how cells respond to their environment. But now I'm going to shift to the second half of the title, right? So cells in orthopedic repair. And I'm specifically going to focus on something called the intervertebral disc. So this is what's in your spine. So in your spine, you have a bunch of pieces of bone, and in between the bones, you have these discs. And I'm sure everyone's heard of a slip disc, something like that. Their disc is herniated. This is what they're talking about. And I almost equate this to like a jelly donut. Okay, so the disc has a surrounding portion that's kind of like your dough, and in the middle has some jelly. And now when your two bones come together and try to push that jelly donut, luckily the dough is able to hold the jelly within it. Now, when that donut tears, the jelly can obviously leak out if you push down on it, right? So that's bad. And that's actually something that happens. You can have a tearing of that outside edge of the donut. And what's really cool is I mentioned that the type of matrix as well as how it's organized are very important for how these tissues respond. So around the edge of this donut, the fibers of the matrix are actually aligned along that circle. So that helps it keep the jelly in. But what people are showing now is that in a healthy outside disc, that it's very aligned. Like I mentioned, that matrix is aligned along the outside, and your cells are happy. But that when you break that, so if you have a tear in the outside dough of the donut, then your cells will respond poorly. So an example of that is this. So this is actually in a healthy disc. You can see that your cell, so this is an individual cell here, and in blue is the matrix around it. And you can see that it's pretty aligned along that axis. However, when you actually disrupt that network and that matrix around, now it becomes more disorganized. It's not as aligned, and your cells will actually change their shape. You can tell that they're spreading out more, and they're actually starting to lay down more matrix. So in green here is new matrix that's being made. So on the left, there's not much. That's a healthy environment. And on the right, they're making this matrix that's not aligned anymore. And this then, if you have a tear of your disc, is bad. I'll actually skip that part. So cells in orthopedic repair, I'll talk now a little bit about some of the work that we have going on in the lab. And hopefully giving you enough background to at least understand that cells do respond to their environment around them, that they can scar, that they can degenerate, they can break it down, and that's really important to their behavior. So what we try to do in the Patel Lab, which is split between the VA and Emory, is try to address some of these tears. So has anyone here had a cartilage injury? Show of hands. Yes, a few. How about a ligament tear? Few. Okay, meniscus. Anyone? Meniscus? Okay. Who here has known someone that's had one of these? All right, that's about everyone. Okay, so these are very common, right? These are injuries that happen, and some of them are mild, some of them are more severe, but unfortunately, all of them lead to long-term damage. It leads to a potential knee replacement or hip replacement, and we want to try to solve these tears and injuries early on so that you don't advance to that stage. And what we try to do in our lab is try to develop new repair and replacement strategies. Is there a different way that you can suture these tendons back together? Is there a different way that you can make a new tissue and implant it? So there's a few different approaches to that, but the main thing that we try to do in the lab is understand what's going on at the cell scale, right? So how are the cells in these environments responding to their environments, okay? And ultimately, we use that cell behavior to then work up to the tissue scale, work up to the organ scale, and really understand why those tissues or how those tissues are generating, and allows us to tune how we can regenerate them or treat them. Okay, so I'm going to take a quick tangent here and talk about our new home. So I've mentioned the Patel Lab. That's obviously at work. At home, here is my wife and our dog Tango at our home over in Tucker. And one of the nicest features of this home is our deck. Okay, so luckily we bought a home that was partially remodeled, and we were able to have this nice new deck, enjoy it year round. A little bit warm right now, but I will actually compare a deck to cartilage, and just bear with me while I make this. And while I make this analogy, I'm just going to explain to you a little bit about cartilage. So this is actually what a knee joint looks like. Okay, so if you remove the kneecap and just look at the knee joint, this is what it looks like. And there's a bunch of different tissues that come together. So the main tissues that come together are two bones, so the femur and tibia. You then also have ligaments. So there are 4 major ligaments in your knee that come together, and they actually hold those two bones together. If you didn't have those ligaments, those bones would separate and your knee would no longer exist. And then within the actual joint environment, you have the menisci. So there's 2 of them in each knee. And what I'm going to focus on today, which is the articular cartilage. So cartilage is what lines the ends of your bones in your joints, and it allows for smooth motion. So again, bear with me while I make this analogy, but like in the north, let's say northern New Jersey, we have a lot of snow on our decks. Those decks see a lot of weathering, and like that, our cartilage also sees weathering, right? So we might play some sports, we might go for a run, we might tweak our knee or our ankle a little bit, and that causes wear of our joints like this weathering. And unfortunately, you can end up with rotting deck boards, or in the case of our bodies, end up with arthritis, okay, and the need for a knee replacement. So keeping this analogy going, some of the treatments for injury are removal, repair, replacement. So a lot of times a surgeon, what they'll do is if you feel a little bit of catching in your knee, let's say, they'll go in, they'll remove that piece of torn cartilage, and then it feels a little bit better. You don't feel that kind of grinding in your knee or your hip. And this is great short term. However, if you remove a deck board, you have to watch yourself, right? You can't walk around, you have to walk around that deck board. Now you're placing more stress on the deck boards that are next to the one you removed. And then you might have to remove those and remove those and remove those, and eventually you have no cartilage left. Another technique is repair. So they have at Home Depot or Lowe's, they have this wood filler that you can kind of paste on that rotted section, kind of fills in the space. And there's a few different repair techniques that are out there that are similar to this. But are you replacing this cartilage with new deck? No, right? You're putting in something to fill in the space, and it doesn't have the same properties. So over time, that will also wear away, and then you're kind of back to where you were. And the final thing that you can do is replacement. So what they can do is they can actually take cartilage from a different area of your knee or your hip or something, and then put it back into where your damage was. But is that really helping anything? Now you have an empty deck board somewhere else, right? Now you you have maybe a mismatch as well. If you take cartilage from another region and put it into this place, it might not have the right properties. So you might have this mismatch in terms of color. So not always optimal. And the last option is maybe perhaps one of the worst options is actual replacement of your entire deck. So this can be costly. You now have, if you have any sentimental value in that deck that you had, you now have lost that, right? So I think that's where some of the things that we work on in the lab try to improve some of these potential options, or improve on these options. So the reason why I bring up this analogy is it helps me explain exactly how what we're trying to do in the lab. All right, so the first method that we work on in the lab is this preservation via reinforcement. So it's almost like a wood hardener. So let's say you have some of these deck boards that are slowly deteriorating. You can apply this wood hardener solution, which seeps into this damaged cartilage, right? And we can actually reinforce it and keep it from wearing away over time. So that's one option. And I'm going to talk to you a little bit about an approach in the lab that's trying to do this. The second thing is to enhance those wood fillers that I mentioned before. Is there a way that we can get these wood fillers to eventually turn into new wood and actually a new deck? So if we take a look, and I'll explain what this procedure is in a minute, or a little bit later, but really, if you have this repair environment where you have this cartilage, can we actually fill it with new cartilage now? Can we guide that cartilage towards a new repair, and specifically by using the cell's environment and how the cell responds to its environment? So how are cartilage cells responding to that initial damage and degeneration? So before I talk about our repair strategy, I'll tell you a little bit about that. So here's an example of a healthy knee joint. So if you look on the top, that's the healthy joint. And on the bottom focuses in on a single cell. So like I mentioned, in the blue is a cell, and in the orange around it is the matrix that surrounds it. And usually cartilage cells are in this really dense environment. And it's a really strong, resilient environment, right? Our cartilage really needs to be able to withstand force. And you can tell that this cell is now signaling in a healthy way. Unfortunately, if you have an early injury, all right, something that happens, you tweak your knee or your ankle a little bit, you have changes that happen. So your cell will start to actually spread into its surrounding a little bit more. And that's because the area around the cell starts to weaken. And if that weakens, your cell spreads into that area, it changes shape. Those actually have negative consequences on their behaviors. These cartilage cells like to be confined within this really dense environment. So we've been actually trying to understand how what's going on here, because as those cells spread a bunch and as they start to become unhappy, they actually start to release these enzymes that break down it even more and more and more. So over time, your cartilage cells, once they become a little bit unhappy, they almost reach a point of no return where now they're going to become more and more and more unhappy and break down the cartilage. And that's how, you've probably heard someone say, hey, I don't have any more cartilage, or my cartilage is completely wore away. This is the process that happens. And this is actually what it looks like, right? So at the end, your cartilage layer, if you look at the top image, and sorry if it's a little bit small, but your cartilage is completely wearing away. And if you look at your cells, now they've completely changed their shape. And they actually can start to die from that. And once they start dying, then the matrix will start wearing away as well. And then you get to the next level. So if this starts from the surface and you have a layer of cartilage wear away, now the next surface is unhappy, that wears away. The next surface is unhappy, that wears away. And then you're down to bone on bone. So what we're trying to do in the lab here is to rehabilitate these cells. So the first thing is, can we restore it? Can we take that early injury wear, so sort of what's in the middle there, and get our cells to feel like they're happy again, okay, and restore their behavior? Or can we at the least delay or prevent the progression from that early damage to this now cell death, your cartilage completely wearing away? And the way we're going to do that is to fortify the matrix around, or reinforce the matrix. So again, I mentioned that's really important to how cells respond. So if we reinforce that matrix, perhaps your cells can get back to what they were feeling. What we do in the lab is we actually develop these biomaterials, so these new materials to try to treat these injuries. And I just want to highlight Michael Kowalski, who was a post-baccalaureate fellow in our lab. He graduated from Georgia Tech and is currently applying to medical school. And he did a lot of this work that I'm about to present, or he's been really on this project and done a lot of work in this space. So what Mike did is pretty simple. So in the gray here, you have a piece of cartilage. And again, apologies that it might be a little bit small and hard to see, but in the gray area, you have cartilage. And imagine if the surface layer of that is starting to experience some of that early wear and that early damage. And he applies this solution of this biomaterial on top of that cartilage. We give it about 5 or 10 minutes, and that biomaterial actually seeps into the tissue, kind of like the wood hardener, right? And then we can actually apply light and make it from a liquid into a solid within the cartilage. So now that damaged environment that's starting to loosen up a little bit, your cells are starting to spread into it, it kind of reinforces it and can maybe confine those cells back to their original environment. So again, not going to go too much into the chemistry, but we use something called hyaluronic acid. Who's heard of hyaluronic acid? A good amount of people. Good. So this is often injected into the joint. But what we're able to do is we can actually take that hyaluronic acid on the left, that's the base molecule, and then we can add a group in blue to it. And this group that's in blue will actually allow you to go from a liquid injection that you would just get of hyaluronic acid to now something that forms an actual solid and can stay within the cartilage. So this is something that has been done for about 15 years now. Just this application of it within the cartilage is something that's a new direction that's exciting. So one of the first things that Mike did was just verify that it actually does seep into the cartilage. So if you look at the little, the color's a bit tough to see, but there's these specks, kind of these dots all the way around. Some are blue, some are not. Those are the cells that are in cartilage. And in the green is our actual material. So definitely our material is diffusing in and surrounding those cells that are in the surface layer of cartilage. So that's something that was really exciting to see. So now we're, changing the environment around the cell. I'm going to talk something about, it's called a modulus, but really just, it's a measure of stiffness, right? And your cartilage is very stiff to begin with. So this is healthy cartilage. It's somewhere between 100 and 400 on this scale. However, when we actually mimic what happens during arthritis and some of that early wear, you have a drop in this stiffness. So again, less stiff cartilage means that it's more likely to be damaged and wear away. However, when we apply our material, you can see that almost all of these come back up. Maybe not to the level of the original healthy tissue, but at least we're restoring some of those properties so you can restore some of that resilience that cartilage has. And this, again, relates back to the wood hardener, right? So if you have a nice a fresh piece of wood, and then you have a rotting board, if you can at least partially restore that rotting board back to, close to what it originally was, that's definitely a success. However, one of the things that we thought of was, does this reinforcement have a sustained effect? If we apply that wood hardener and it just works for a day and then it goes away and then you're back to your rotting board, that's not going to help you, right? And in the context of your cartilage, you want this to last for hopefully at least months, if not years, right? So what we want to see is, does this have a sustained effect? So it's actually kind of cool. We can take pieces of cartilage from different joints. So we actually can grab fresh joints from a slaughterhouse, let's say, and grab cartilage from those in a sterile way, and then actually keep them alive for weeks and weeks in the lab. And what we'll do is we'll culture these out. So that's what it's called, is a culture of these cartilage pieces. And we can actually simulate sort of arthritis and different things within these samples. So this is a piece of healthy cartilage. And you'll notice just one thing. This is a really thin slice of healthy cartilage, and we stain it. We stain it with this one stain that stains these healthy components of cartilage. And you'll notice that it's just red everywhere, right? That indicates that this is a healthy piece of cartilage. However, when we start to degrade that cartilage, you'll notice that now the top layer of that cartilage has a lot less red, and it's more blue. And that's indicative of not healthy cartilage, okay? So this is actually us on the top saying this is a healthy piece. This one is saying, okay, now we mimic what happens sort of during arthritis, at least the early stages of arthritis. Now we applied our material and we're back to sort of red everywhere. Now, again, not fully. I'm going to be fully transparent that we don't restore that original cartilage, but we're getting close. So where to now? I could go into some more results, but I think just talking about these broad themes is great, right? Where if we're able to show now in these living plugs in a dish that things are going well, what are we going to do now? One of the cool things to take it back a step is to look at the cell scale. Again, the cell and its environment around them. What is our treatment doing? So this is actually, if you look at that white circle in the middle on both of these, that's where your cartilage cell is. And around it is a map of the mechanical properties around the cell. So how stiff is its environment? So on the left, you have a normal. On the right, you have an arthritic one. And one thing that you'll notice is that in your arthritic joint, you now have this blue environment around the cell, which indicates that it's weaker. Okay, so we now want to see, and we're actually able to measure these properties in our treated cartilage to see, do we restore the area and the environment around the cell back towards that normal value, or because we know that that is really helpful to maintain cartilage health. We're also looking at the shape of the cells. So these are individual cartilage cells here, and you can look at, are they spreading into their environment around them? Are they exhibiting those changes that you normally see during arthritis? And also, we're doing these cool techniques in the lab where you can see, I don't know if you can see it, but there's these like little green dots buzzing. You can actually measure the response of these live cells to see how happy are they. And that's one of the things that we're doing in the lab now. But ultimately, I'll skip this part, but ultimately we want to translate this to people, right? We want to make sure if this treatment's working in a dish, can it work in potentially in animals? If it works in animals, can we now try it out in people so that we can benefit everyone? So some of the things that we'll do is actually test this out in pigs, in farm pigs. And then we can test a lot of these different properties of the cartilage to see, what's going on mechanically, what's going on biologically, to say, are we able to preserve these joints? All right. So that was kind of the first half of what our lab is going through right now, where we're looking at, again, preservation via this reinforcement or this wood hardener. So now I'm going to shift to enhancing repair for these wood fillers. Can we make these wood fillers more like a deck board? Or can we make these cartilage repair techniques that are out there right now more like actual healthy cartilage? So again, that's what I'll focus on now. So I mentioned microfracture really briefly earlier. This is a cartilage repair procedure, and I'll kind of walk through it with you here, right? So I mentioned cartilage lines the ends of your bones, right, in all of your joints. And under that is your bone, right? And that bone actually has a lot of marrow. And marrow is very regenerative. It has a lot of these elements that can help with regeneration. So what surgeons thought of doing back in the 70s and 80s was that they could actually, on the left, clean out the damaged cartilage. They could puncture these small holes into the bone that's under the cartilage, and that allows that marrow that's in the bone to infiltrate, come up, flow into that missing cartilage space and make new tissue. So you're like, okay, this is great. This is cool. We get these regenerative elements in. We can actually make new cartilage. So this is what it looks like in an arthroscope in terms of how they puncture the holes. And actually, this technique in general is being applied to many tissues, not just cartilage. It's being applied to the meniscus, to rotator cuff, and it's really becoming an exciting field. However, one of the things that's not happening so well is that the outcomes are not so great. Usually after 5 years or so, that tissue is gone. It's just worn away. And one of the reasons why that happens is, if you look at this image here, if you remember what I said, healthy cartilage stains what color? Red. So on the sides of this microfracture, it's red. So that's your healthy surrounding tissue. They did a microfracture right here, and that tissue is blue, which indicates that it's not new cartilage forming and it's not happy cartilage, right? So that's something that we're kind of working on, is try to understand, well, why might that not work? And because this is not new cartilage, we've shown that the stiffness of this material that forms is about 100 times less than actual cartilage. So you can imagine that as your joints are wearing, that new tissue will just wear away. So this is a cool graph. It's actually of athletes, and each line, there's 4 lines, indicates a different sport, one of the 4 major sports in the US. And what you'll notice is that on the left, it all starts at this number 1. So it indicates that 1 is basically a 100% chance that this microfracture will survive. And as you go over time, you can see that this rate drops. How many of them actually survive drops. And that by 5 years, less than 40% of these microfractures actually still are there, which tells you that this technique doesn't quite work, yet surgeons perform it a ton because it gives you temporary symptom relief. It might delay knee replacement by 5 or 7 years, right? So there's still some benefits to it. I'm not saying that your surgeon's trying to deceive you or anything. It's more that we are now thinking, why is this not working? And can we make this technique that's done routinely, can we make it even better? Can we somehow influence the environment around the cells in this microfracture to try to get new cartilage to form? So I'm going to talk a little bit about cells pushing and pulling on their environments and how this might relate to scarring. We talked about liver and lung scarring earlier, and we feel that something similar is happening here. So what we noticed is that if you look at this is actually a study that was done in pigs, this is your microfracture here, that some of them are kind of like collapsing and they're contracting. And what we noticed was with this graph, and not to get too much into the numbers, is that the more that the defect was filled, the better the quality of tissue. So we obviously want to make sure that our environments are not contracting. The more it falls on top of itself, the worse the repair is. And one thing where we see a lot of contracting things happening is actually the blood field. So there's some really cool research going on. So in the green here are platelets, and in the red is the matrix around them. And over just an hour of time, these platelets are able to pull the matrix towards itself. And this is a form of contracture. And that's actually what happens if you have a cut on your skin, right? It bleeds a little bit. You have platelets and other cells that come in and are able to contract that environment. However, we're showing that this contraction is actually a bad thing in terms of cartilage forming. So now we're trying to investigate this a little bit further. So this is actually work that we've done in the lab now that'll pop up. So these are actually cells that are within the marrow that flow up in, and outside in a dish, we're able to recreate what that microfracture is like. And you can see that cells are starting to contract the environment. So in green is the matrix around the cell. And then you can see that there is this heat map that shows up. So this is just indicating the more green and red it gets, indicates how much the cells are pulling the matrix to itself. And you can imagine that the more the cells pull things to themselves, if you look at it at a tissue scale, you end up with the contraction that's going on up here. So that's what we're now thinking, is that let's prevent contraction at the cell scale and the cell's environment, and that might help to prevent contraction at the tissue scale. So one of the drugs that we've been using, unfortunately, I can't tell you exactly what it is yet, but it prevents that contraction. All right. So yeah, unfortunately, I can't tell you yet, but hopefully within the next year or so, we'll be able to. Sorry, say that again. It is not a steroid. It is not a steroid. So, but those can help with that. Yeah. So can we change and help how these cells push and pull? And this is something, this is work that actually an undergraduate, so Maddie Hassan, she's a rising junior and just phenomenal. She's so bright and so helpful in terms of this work that was going on. And what Maddie and I did was we investigated this pathway, and there's no way I'm telling you about this pathway, but this is basically the pathway that allows cells to push and pull on the matrix around it, okay? And what we can actually do is, and I'll kind of have everyone do like an activity at their table here, is that we can put cells into these microfracture mimicking environments or microfracture mimicking matrix, and then they can push and pull on it. So everyone, if you take one hand and put it on the table or somewhere around you, maybe grab a chair and try to move yourself around. You can probably do it a little bit, right? It's a little easy if you have your hand on the table, right? So if you're, I don't know, just like this, right? You can kind of move yourself around, okay? We can inhibit this pathway that allows cells to feel this environment a little bit less. And what happens is, imagine now if instead of your whole hand, you only use one finger and try to move around, it's a lot harder. And that's what the cells are doing, okay? The cells are less able to pull all of that matrix to itself and contract. And you'll notice that different doses of this drug, so 10 and 50, are allowing this matrix to contract a lot less, where the maximum dose that we applied allows these microfracture matrix arrays to kind of stay to maintain their size. We also did the opposite. We said, what if we improve this, right? Let's make the cells now go hyperactive and push and pull a lot more. So there's another drug that we can apply. And this one actually didn't cause too much of a change in terms of how much they're contracting. So just imagine now if you put both hands down, is it very much different than one hand? So there's almost like a threshold that if you reduce it, then it gets a lot tougher. But if you increase the ability to move around, it doesn't matter too much. So the baseline level of contraction that's happening in this microfracture is bad. So these are just them over time. I won't go into the actual data, but this is what I found as a really cool image because it relates what goes on at the tissue scale as well as the cell scale in terms of their environment. That if you look at the top one, you can tell in the blue there's the matrix, in the red there's the cell, and the cell is able to pull a bunch of that matrix to itself. However, when we treat it with this drug, the matrix is just kind of where it was, that it's not densified around the cell. And this is really influential. And one of the things that we think is happening is that normally in microfracture, what's happening, is that the cells are able to pull a bunch to themselves. And like we mentioned with the liver and lung, what happens then? They want to make more matrix and make more matrix. And that's actually a bad thing. That causes fibrous tissue to form, almost a scar forms rather than new cartilage. So now we're looking into ways that if we can prevent that initial contraction from occurring, maybe that will be helpful in terms of forming new cartilage. So where is this kind of going now? Well, some of the things that we're working on are, can we tune the cell's environment? So can we change that initial microfracture in any way to help our cells out? So we can actually see, again, individual cells and how they respond to this environment. We can also look at the state of the cells, so we can actually stain them for something that allows us to that tells us how happy or how unhappy they are. So ultimately, if you take this microfracture that we do, it ends up becoming sort of not right tissue right now. But if we're able to actually inhibit some of that scarring that occurs, maybe we can make better cartilage. So I hope I've shown you a little bit. And again, I'm happy to answer questions on this. I realize I didn't go crazy into detail, but that's, I think, what the discussion is for. I hope I've shown you that we can preserve our deck and our cartilage potentially with these tissue infiltrating, molecules and stuff, as well as enhance repair by influencing, again, the environment around the cells and how the cells perceive that environment, how they're able to push and pull on it. And again, here's just some nice images from throughout the talk that kind of display some of this. And again, getting back to what we do as a lab, right? I mentioned these ligament, meniscus, cartilage tears. There's bone fractures. There's a bunch of these environments where if we can understand better how the cells impact their environments and how the environment impacts the cells, we can then actually guide treatments for these tears a bit better. So it's also about finding the right set of environmental factors. I mentioned just the matrix around them, maybe how soft it is or how stiff it is and how they respond to that. But there's also other things like inflammation or swelling that can add other environmental factors that can influence how tissues heal and regenerate. So those are other things that we're also looking into. And then finally, I mentioned this thing called tissue engineering earlier. It was when the remote quite wasn't working well. And this is something that helps me kind of understand an environment and how these factors influence us. So tissue engineering combines these three things. So at the top here, on the top here, we have cells, and cells are kind of like the nature, right? So that's us, okay? Materials, so these are different biomaterials that we can use in the bottom left here, are different ways, of basically our physical environment, the house we live in, the city we live in, things like that. And then there are these factors on the bottom right that are more sort of the temperature outside, other things that are less physical that also influence us. So combining nature, which is our cells, with the environment around them, and potentially some signaling things and other environmental factors, those combined can help us regenerate tissues. And it's really understanding the balance of all three that's really important. So I'd like to just thank a lot of people. Obviously, I'm not going to go name by name, but it really does take a village and a great environment in each place to raise a scientist and an engineer and to try to do some of the work that we're doing in the lab here. So from people at Rutgers to Penn to Emory, a lot of funding goes into this. So we've gotten funding from the DoD, from the VA, from the NIH to really fund this work and try to understand, again, what's going on at the cell scale and how that influences health and disease. Feel free to check us out. So our website is the-patel-lab.com. I'm also on Twitter. I'm mostly a science Twitter person, so happy to follow you as well, see what you've got going on, and also happy to take emails as well. I'm more than happy to answer any questions that you might have beyond this as well. I'll have this slide up again in a minute in case you don't get a chance to copy it down. So finally, I want to talk, I talked about sort of being a product of your environment in terms of people, and then going down to the cell scale, talking about our work. And then now I'm going to pull us back up to people and how we may be products of our environment, but we can guide them. Okay. And this is something that's really, I don't know, just near and dear to my heart in terms of talking about this. So you have things that are really influential in terms of your environment, your family, your city you're in, your friends. You have things that are also influential, but maybe a bit more guidable, like your house, your car, your job. And then you have things maybe that aren't as much, like your health, your temperature, home decor. You kind of work your way down, let's say. And these are all environmental factors that influence us. What we've seen with our cells is that all of these things, right, the matrix around them, the different proteins that are around, this and that, can really influence what goes on. But what we found with that last bit of microfracture work is that the perception of all these things is also very important, right? Your cell might not be in the ideal environment, but if you can trick the cell into thinking it's in the ideal environment, maybe you can actually preserve the joint or regenerate cartilage. And like us as well, our perception of these things is important. So a glass half full versus glass half empty approach, right? There's also optimist versus pessimist. And I'm not saying you need to be one or the other. I have a little bit of both in me. But I think that these are really important, both in terms of our cells, what they think of their environments, as well as us. So I think it's really about, and I have a dog that I mentioned earlier. Our dog trainer always used to tell us, set yourself up for success. And I think it's more about us than the dogs, that, you really want to set yourself up to succeed in that environment. And your perception of this environment is really, really influential. So I'll leave you with that. Here's just a final slide of, again, the contact information, some cool images from today. Our lab group, we went hiking about a year ago. So, and with that, I'm happy to open this up for a discussion. Thank you.
Dr. Patel, I wasn't going to be quiet for long, right? So one of the interesting part that she was talking about is that the growth hormone and growing is part of the factors that will promote genesis of chondrocytes. And she's talking about viscosupplementation or exchange of synovial fluid, which is not the topic. It's very good. It has paid my salary for the last 12 years. We can talk about it later. But now with Dr. Patel. But what I wanted to talk to you about is that, by the way, thank you, because this is amazing. And I believe that, just as a little recommendation, you forgot to remind us that if we all want to live long, we will all going to have osteoarthritis. I mean, this is a disease that is more prevalent the longer we live, because we are born with the same knees. So even using it a little to use it in a lot, both will harm our knees. So that's a very interesting part of the biology. But now I want to go to microfracture part, because I'm very interested about it. The AOS, or the American Orthopaedic Association, does not recommend microfracture, although they make it every day, which is ironic. But what we know is that when you stimulate this mother cells, with these microfractures, there's something missing that we haven't got in science for create new cartilage. We have managed to create new extracellular matrix that is not worth new cartilage. And in the moment we create new cartilage, we're going to cure arthritis. We're going to win a Nobel Prize, and we are all going to move somewhere in the paradise with so much money. But the question to me is, if you have any experience, not only with PRP, but probably when you're talking about scaffolds, you're talking about platelet lyset or other growth factors that could help these microfractures to grow. And this is frustrating to me. In a personal note, I failed on my own research to find something that will make these microfractures create new cartilage. So do you know anything that have improved the quality of life, which is the growth outcome that we look for?
Yeah.
Aldous wants his microphone back, so I better.
Thank you so much for your thoughts, your questions. To your first point, right? So you mentioned, we're all the average age that people are living to is increasing and increasing. So I think that we're never going to be able to fully, prevent joint replacement. It's going at some point. It will happen. Maybe not to everyone, but it is very common, right? Especially in older folks. But if we can, let's say you have someone that's injured at 20 and they develop arthritis by the time they're 30 or 40 even, now they need a knee replacement when they're 40. And the complication, really, knee replacements actually work relatively well. So there aren't a crazy number of complications. It's not a very complex procedure. It's now a same-day procedure where you're just in and out the same day and back home. The issue is the revision. So if you need to get that knee replacement replaced, that can be very tricky, because now instead of just taking off the ends of the bones and putting in metal, now you're taking metal off of the bones and putting new metal on. You don't know the state of the bone, and that can be very tricky. So that's where a lot of these treatments that we work on are for early in disease, to at least give, even if it's 5 or 10 years, that can be really beneficial to patients in terms of that age number. You have a question? Is it okay if I answer his second one first? Or, yeah, all right. Second question, you mentioned PRP, platelet lysate. I'm sure others have heard of injections like even stem cell injections, hyaluronic acid. And it's just that most of the ones that I've seen that are just for joint injections for arthritis, they go out of the joint pretty quickly. They can actually leave the joint really, really quickly. But if you combine it with microfracture, it does improve it. We just submitted a grant about platelet lysate in microfracture. So thank you for bringing that up. But what I mentioned earlier was that when you do microfracture, it ends up being about 100 times less stiff than actual healthy cartilage. And what people have shown, and this kind of gets at your point earlier, is that whereas the field advanced, the initial attempts to augment microfracture maybe doubled those values, but now you're 50 times lower than healthy. Now, recently, we've gotten to maybe 10 times. So it's really that these treatments and combining it with microfracture, we're not there yet, right? But I think that finding that right combination and what factors in each of those get us closer and closer to healthy tissue. Yeah.
Hey, I have a couple of questions.
Sure.
And I'm sort of like asking on behalf of my husband, who doesn't have the question, but it's about his injury. He had issues, and he goes to the doctor and they say, "Oh, you're not an athlete, therefore we won't fix you." And so I'm kind of wondering, like, where you position like the treatment you're looking for. Are you how would you expect a doctor to treat early injuries? Would you let them would you think it's a good idea to be like, "Hey, you'll just heal yourself"? Like,
yeah, and again, I don't want to provide any medical advice here, just because it's a little outside my area of expertise. But from what I know, a lot of the work that we do, right, we work with sports medicine agencies, we work with sports medicine surgeons, so they are treating a lot of athletes. It's really, what are you trying to get out of this repair or this approach, right? If you are just trying to walk, or if you're trying to run marathons, the treatment approach will be very different, right? So I think that's probably the difference in terms of the approach. It's not to say that they preferentially treat athletes. It's more just that they're willing to try some of these these augmented microfracture techniques that may or may not work, but if it gets the athlete another 5 years at that elite level, then it's worthwhile. Whereas someone maybe that isn't as athletic, that just wants to walk, get around, maybe go on a jog here and there, then it's not as important to try some of these techniques. Yeah.
Yeah, I asked that just because our knees just degrade. Like, would it prevent that from happening in older age? But my second question was having to do with my father. He let his knees go completely. Like, I think he had no cartilage. And he did a knee replacement. And I think his knees was better, but he was in constant pain, even though he had done that surgery. And I'm curious if you have any comments over changes, like how age plays a factor and how well your treatments or what you're looking at.
Definitely. So what we see actually over time, so I mentioned this microfracture procedure, it's relying on the marrow to come in and flow in, and your marrow, when you're really healthy, is full of these regenerative cells. And what folks have shown is, as you age, that marrow, you lose some of those regenerative cells, and the marrow actually becomes fattier. So you have less regenerative elements, you have less elements that'll come in and actually repair cartilage. So you won't do microfracture in a 60-year-old. You might do it in a 30, 40-year-old though. So that's where there is a difference, because now, again, every person is different. You could have a 60-year-old that doesn't have fatty marrow and a 30-year-old that does, right? So that's where it's really tricky. And one of the things that we're trying to do now is actually take cells from different donors and try to see, hey, is there a difference in the regenerative potential, and what are the specific markers from each person that allow us to do that? So maybe before you get this, it's a simple blood draw to say, hey, your blood has these certain regenerative elements, or your marrow might have these certain regenerative elements that then will make you a better or worse candidate for this procedure. So there's definitely, I think that's a nice direction in medicine, is personalized medicine, right? Yeah, thank you.
All right, we have one more back here.
For the lady over there, I've had both my hips replaced. They're expected to last the rest of my life. I ran a half marathon at Thanksgiving. Okay. I had to go out of state to do it, though. You can't get the surgery in Georgia.
So my father that I mentioned earlier, he got both of his hips replaced in 98 and 99. And he's still going. He said, the doctor said, hey, you're up for another, set of hip replacements, but he's going fine. And, sometimes they recommend a time, and it could just again, dependent on each person. Thank you.
All right, everyone, please give Jay a hand.
We hope you enjoyed this presentation. For more information on Science for Georgia's mission and our past work, visit our website at scienceforgeorgia.org.